I've been having some pain with my throat. It's been very sore and it's been really uncomfortable. I haven't been able to sleep well at night. I haven't been getting a lot of sleep at all because it's just kind of been plaguing me. So I'd like to get some relief for it. Yeah, it kind of hurts.
Okay. On a scale of 1 to 10, how intense is the pain?
It's about an 8.
8. And when did these symptoms begin for you, Alessandra?
They began about 4 days ago.
Okay. Is anybody in your household sick? Have you been exposed to anybody that had any symptoms?
I'm not sure where I got it. No, no one in my house is sick.
Okay. Are you struggling to fall asleep? Just can't shut off your mind? Then let me introduce you to today's sponsor, Medterra, a CBD and full spectrum hemp brand. I gave their true full spectrum deep sleep hemp gummies a try. These gummies are potent. They harness the full range of the hemp plant for a deeper and better sleep. Deep sleep gummies are vegan, made in America from organically grown non-GMO hemp, lab tested and third-party verified. A product you can trust. Experience the sweetest slumber with a dreamy blend of CBD, THC, melatonin, and additional minor cannabinoids. Fall asleep faster, stay asleep longer, and wake up feeling refreshed. Get your deep sleep hemp gummies from Medterra today by clicking in the link from the description down below. You won't regret it. Does it hurt you when you swallow?
Yes, definitely. I tried taking some over-the-counter medicine. I took Tylenol, but it still isn't helping it like I would hope it would be.
Okay. When is the last time you took a Tylenol dose?
I took it about 4 hours ago.
And can you describe a little more the sensation that you feel in your neck?
Yes, so it feels very scratchy, and when I swallow, I can feel, it feels like a big lump, and when I drink cold water, it's kind of unbearable, so I've been trying to stick to drinking tea and drinking hot water because the cold water just is very uncomfortable.
Okay. Do you have trouble speaking sometimes?
Oh, yes.
Okay. I'm not seeing any obvious signs of any swelling, but we're gonna have to do a more in-depth examination to figure out if you have maybe a viral or bacterial infection or something related to the skin. Okay. Do you feel any numbness or any tingling sensations anywhere in your body?
Yes, I do feel tingling. Not so much numbness, but I do feel the tingling.
Okay. Can you point to where you feel that sensation?
Probably on the sides.
Okay. Got it. How about the midline of the throat?
The midline is more soreness. The tingling is mostly to the sides.
Okay, so right here we have pain and tingling on the sides. Okay. Going to go ahead and put my gloves on. May I have your index finger, please? Good. This can rest right here. So go ahead and relax. I'm going to listen to your heart. Just breathe normally. So I'm hearing normal rhythmic activity. I'm going to listen with the bell side as well. Good. Now let's take a deep breath in and check the lungs and out. Deep breath in and out. Good. Good. Now you can breathe normally. I'm also going to check the base of the lungs. Good. So I'm not hearing any signs of bronchitis, no adventitious sounds, so the lungs are clear, which is a very good sign. Okay, oxygenation is good as well. Good heart rate. I'm going to take a note of this. How's the throat feeling? A little better?
It's already feeling a little better.
Good. Okay. So 99% oxygenation. 75 beats per minute. Are you an athlete? Do you do any regular sports or exercise?
I go walking a lot, but nothing too strenuous.
Okay, and lungs and heart. S1 and S2 not present. Okay, good. Are you allergic to any medication?
I am allergic to amoxicillin.
Okay. So if I need to prescribe any antibiotics, then I'll stay away from that. Prescribe you some other broader spectrum other than amoxicillin. Okay, good. I'm gonna check your temperature as well. Okay, good. 98.3, but yeah, any fever would be masked by the ibuprofen. So we can't really rely on that. Now go ahead and check your temperature, your blood pressure. So this is going to go right arm over your artery, so like that. Good. Can just rest it. Good. Good news is that the blood pressure is also within normal range. Over 65. Okay, very good. Right. Next up, I'm just going to observe your skin and your neck and see if I see any visible signs of anything that might be a condition related to your skin. Okay. All right. And then we'll take a look inside your throat. I'm noticing a little bit of a swellness over here on your right side. A little bit of redness too, right above your right clavicle. Okay, let me go ahead and palpate. Go ahead and close your eyes. I'm checking for symmetry. The right side is definitely more indented. Going to check your lymph node. Okay. Your submandibular lymph node is a little inflamed, which may indicate response to a viral infection. Going to check the supraclavicular lymph node. they're not enlarged. And the auxiliary lymph node. As well as the pectoral line. No, not enlarged. Good. Okay. Okay. So I'm going to make a note of the fact that your submandibular was enlarged. Occipital, pectoral, auxiliary, we're okay. Okay. Right. Next up, I'm going to just use my medical hammer to tap on your body to check for basic neurological responses. So go ahead and relax. I'm going to start at the top of the head. Good. Good. You can leave your arm loose to the side. Yep, give me all the weight. Good. Same on this side. Good. Good eye reflex there. Good. If you can open your mouth a little bit. Good. You can close it now. Right, let's take a look in the back of your throat. You can open the mouth for me. Okay, say Yep, definitely red. And I can see some pouches of white dots, which may be consistent with strep throat. Okay. So I'm going to be suspecting a bacterial infection as of right now. I want to take a closer look at this patch of redness here. Do you usually wear any necklaces or anything around your neck?
Occasionally.
Maybe some contact dermatitis. Let me just look. Going to apply some solution so that I can take a sample of the outer layer of dermatitis. the reaction has begun. I'm going to go ahead and let the catalyst activate the skin. And I'll take one sample. I'm gonna send this to the lab and see if we're dealing with just pure contact dermatitis or anything else more troublesome that we may need to treat with medication. Okay. Go ahead and also check your eyes and your ears. Have you had any trouble hearing or seeing?
No, I have not.
No. Okay. Good. Just good. There you go. All right. I'm just going to take a look inside the ears first. This is part of just the annual regular checkup. And if there's any bacterial or viral infection, it may also affect the ears. Good. Okay, you can look over to your left. Okay. No discharge, normal tympanic membrane, pearly gray color, all the bony landmarks are present. Good. Good. No signs of an infection. Any trouble seeing? Blurred vision, double vision? No. Good. Okay. Can look into the distance for me. Keep your eyes open. Just gonna try to. There you go. Okay. Okay, optic disc and optic nerve are intact. Ears and eyes are okay. Okay. Sandra, I'm going to take a look at your tummy. Is it okay if I unbutton your skirt? Okay, let's tuck that in. First going to do just a visual inspection. feel light. Taking a look at your belly button, which looks normal, no signs of any infection. Okay. And under regular light, okay. No redness, no signs of any allergic reactions of the skin, no contact dermatitis. Okay, good. I'm gonna go ahead and just palpate. Check for any masses, lumps, bumps. Starting off with the light palpation. And a slightly deeper one around the tip of your liver. Which is not enlarged. Okay, good. Now, go ahead and do a sensitivity test on your tummy as well. So go ahead and let me know if you feel a sharp or a dull object.
Sure. Dull. Dull. Sure. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. Dull. Sharp. Dull. Dull. Sharp.
Okay, very good. I'm also going to auscultate your abdomen. So go ahead and just breathe normally. Going to listen to the 4 quadrants. Normal abdominal cavity sounds are heard. No swooshing sounds or anything concerning. Okay. I'm also going to check the maxillary sinuses. The frontal, sphenoid and ethmoid. Okay, not feeling anything abnormal. Checking the top of your head for any masses and symmetry. Okay, I'm going to examine your scalp next. Checking for the strength of the hair strand. Not noting any breakages, which is good. Okay. Checking the hairline. And the eyebrows, which are symmetric and no hair loss noted. So no indication of hypothyroidism. Okay, can you tilt your head towards your left side? So this is where we were noting the inflammation earlier. Checking behind the ear. No irritation of the skin, no redness, and no reaction to contact. I'm going to do a series of tests on your face and neck to check for neurological responses that may indicate anything abnormal. And I'm going to start with a sharp object that has two prongs, and I'm going to touch you with either both of them or only one? So I want you to say 1 or 2. Okay, let's begin.
1, 2, 2,
Yes.
2,
Yes.
1,
Yes.
2,
Yes.
1,
Yes.
1, 1, 2, 1, 1, 1, 2, 1, 2, 1.
Okay. Now let's focus on the area here that we noted the inflammation.
1, 1, 2, 2, 1, 1, 2, 2, 2, 1, 2, 1.
Okay. And now I want you to tell me which side of the face I'm touching you, left or right?
Right, left, right, left, right, left, left, right, right.
Okay. Next up, I'm going to touch you with either a wet or a dry object. So I want you to say wet or dry.
Wet, dry, wet, dry, 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 wet, dry, wet, 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 dry.
Okay. And next up, I'm going to touch you either with a sharp or a dull object.
Dull, sharp, dull, sharp, dull, sharp, dull, sharp.
Okay. And next up, I'm going to use a slightly sharper object.
Sharp, dull, sharp, sharp.
Good. Now let's focus on your neck.
Dull, sharp, sharp, dull, sharp, dull.
Okay. Next up, I want you to count how many times you feel me touching you.
Once, twice, three times, four, five, three, five, twice, twice, once, three.
Okay. Do you feel this equally on both sides of your forehead?
Yes,
Okay. Equally on both sides of your cheeks?
yes,
Okay. Equally on both sides of your jawline?
yes,
Equally on both sides of your chest?
yes,
And do you feel me touching you on both of your shoulders?
yes.
Okay, good. Alright, let's take a look at the scalp next. Looking for folliculitis, dermatitis, and I'm not seeing any indications of any contact dermatitis or ringworm or anything out of the ordinary. I'm gonna go ahead and create part the hair in the middle. And inspect the skin.
Two, two, one, two, one, two, two, one.
Okay. Scalp looks healthy. All right, let's take a look at your legs and your feet. Just going to do a visual inspection first. Checking for any edema, signs, redness, swelling. Checking in between the toes. You have a little bit of the skin here peeling off of your toe on your left foot. Does this bother you? Any pain?
No.
Okay, can you wiggle your toes for me? Okay. I'm gonna take a closer look at that piece of the skin there that's peeling off. Okay. Nothing to be concerned of. You may just need to apply a little more hydration. Okay. I'm going to palpate your feet and legs. Can you push into my palms? Good. Now I'm going to attempt to raise your legs. Don't let me do that. Good. And I'm going to attempt to spread them apart. Don't let me do that. Perfect. And now can you point your toes towards your head? And now towards me. Now towards your head again. Good. Okay, plantar region looks healthy. I'm going to do the Babinski test. So let your foot loose. Okay, perfect. Then this one. Good. All right. So now we're going to do some sensitivity tests as well. I'm going to touch you with an object and I want you to tell me when you stop feeling it.
Now. 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 Now.
Good. Now can you move the toe where I'm touching you? Okay. And can you tell me which toe I'm touching you on now?
My right toe.
Okay. And how about now?
Right foot.
Right foot, okay. You can just tell me right foot or left foot.
Good. Left foot. Right foot. Left foot.
Okay, very good. And now, am I touching you with one object or two?
One. One. Two. Two. One. One. Two. Two. One. Two.
Good. Okay. No, you can stand up now. We'll discuss the results. Okay, Alessandra, so I did a very thorough investigation of everything. You did confuse a little bit some of the sensations, so not all of the sensory tests were a pass. So I would like to focus a little more on that with you in this position. So I'm going to go ahead and touch you with something either sharp, so it's going to feel like this, or dull. It's going to feel like this. So keep your eyes closed and tell me if you feel sharp or dull.
Sure. Dull.
Okay, so the chest area is okay. Let's try the arms now.
Sure. Dull. Sure. Dull. Sure. Sure. Dull. Sure. Sure. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Sharp. Dull. Quite sharp. Dull. Sharp. Dull.
Wet or cold?
Wet. Cold. Wet. Wet. Cold. Wet. Cold. Wet. 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 Cold. Wet. 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 Cold. Wet. 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 Cold. Wet. Cold. Wet. Cold. Cold. Wet.
to tell me if you feel this equally on both of your legs. So that's one. Are these two sensations similar?
Yes.
Okay. How about these two?
Yes. Yes.
Okay, good. Okay, Alessandra, this concludes the examination for today. The cold and wet tests were a little problematic for you, as well as the sharp test. I'm just going to make a note of that. I think all we need to do is treat you for the strep infection. So I'm going to prescribe a course of broad spectrum antibiotics other than amoxicillin. I want you to take that for 12 days. And I see that we have your pharmacy on file here, so I'm just going to send that over right now. And let's see how you respond to the antibiotics. And I want you to come back and see me in 3 weeks.
Okay, thank you.